There were some questions about Marfans. Marfans is a different type of genetic connective tissue disorder. It can have some features that overlap with EDS. What basically happens is that more physicians are familiar with Marfans than they are with EDS, and some patients, we don't know why, some patients, particularly males, but not exclusively, with what seems to be a form of hypermobile EDS or HSD, can be very tall. As I mentioned, can have long fingers, can have long arms. So notoriously in the medical field, we refer to those features as being similar to Marfans, or we may even say a person has Marfanoid features, meaning they're like they have Marfans, but they don't. Most people who seem like they have Marfans turn out to have EDS. Again, the good news is there is a genetic test for Marfans, and most of the time that's going to be pretty valuable. So a normal test for Marfans would rule that out. One of the main concerns, or one of the main things we worry about with Marfans, is that those patients can have problems with the aorta, the main artery that comes off the heart. It can dilate, widen, and even in some cases tear. So we'd want to do something about that before that became a problem. And that could be screened for with echocardiograms, ultrasounds of the heart, CT. So even if there were any question, that could be looked at pretty easily. The good news is most people with EDS, especially those who truly have hypermobile EDS, HSD, almost never have any significant heart problems. We do like to screen and get an echo. Sometimes heart valves can be more floppy than they should be. Sometimes there can be dilation of the aorta. And again, if we pick that up when it's asymptomatic, we can follow it. Most of the time, it doesn't change much and stays asymptomatic and remains not a problem. If it does become worse, then we can have surgeons address it before it becomes a bigger problem.